Hello and welcome to today's pelvic health advice session brought to you by Norfolk and Waveney Local Maternity and Neonatal System and Norfolk and Waveney NHS. I am hosting the session today. My name is Jenna Sweeney. I am a pelvic health physiotherapist by background and currently in the role of a practice development physio for the LMNS in Norfolk and Waveney. Now, before I introduce you to Zoe, who's our therapy assistant practitioner in pelvic health, I'm just going to give you a little bit of an overview of the session today. The session is likely to run for about an hour and a half. Now, we realise that can be quite a lot of information to digest, but the beauty of this pre-recorded session is that you can stop and start it, you can absorb it in bite-sized chunks of information, and you can always recap over any information that you need. And of course, you can always jump back into the session at a later date when it may be more applicable information to you, depending on where you are at in your pregnancy journey. So today's session is focused on the changes of pregnancy and the impact we have on our pelvic health. So let me hand over to Zoe for a moment and let her introduce herself.
Hello, my name is Zoe George. I'm a therapy assistant practitioner. I work in the community supporting the pelvic health service, but I'm aligned to the Norfolk and Norwich University Hospital. So my background is I've done 3 years of adult rehab in the community, and prior to that I worked as a midwifery care assistant in the Norfolk and Norwich Hospital as well.
Thank you, Zoe. Brilliant, thank you. So today's information session is aimed to support those during pregnancy and after by providing some general self-care information and advice on pelvic health, whilst also raising the awareness of pelvic health issues and to highlight that there is support available should you need any help at all. We are going to be discussing all things pelvic health related, including wee, wind, poo, vaginas, and importantly, the pelvic floor muscles. So we've got those words out in the open nicely to start with there. Today's session is going to be aimed at empowering and informing you to be able to lead a healthy pregnancy, providing you with a toolkit of self-help resources and access to specialist care should you require it at all. You may not feel everything is relevant right now, but as we said, make sure that you perhaps recap on it at a later date when the information may be more helpful to you. In the session today, we are going to be covering the following. So firstly, I'm going to be talking about exercise during pregnancy and the importance of moving well, keeping active, and the recommendations and evidence that's behind it to support a healthy pregnancy. We're then going to talk specifically about pelvic floor muscles and the importance of exercising them during and after your pregnancy and the real benefits to doing so. We're then going to talk a little bit about bladder and bowels and the changes that you might experience during your pregnancy and again afterwards in that year after birth, and to go through some real top tips, things you might not know about that would be beneficial to you. We're also going to talk about perineal tears during vaginal childbirth and discuss the benefits, or sorry, the self-help information and advice that you can do to help reduce the likelihood of this happening. And then we're also going to make sure that you have access and links and being signposted to resources that you can then look at in your own time. So first of all, let's crack on with a little bit about exercising safely during your pregnancy. And the first thing I want to stress is there are so many benefits to exercising during pregnancy. The recommendations are to complete 150 minutes per week, which can be broken down to maybe 5 sessions of 30 minutes or 10 sessions of 15 minutes. Really depends on sort of your exercise tolerance as you enter into pregnancy. But the aim is to be doing what's classed as moderate activity or moderate exertion and intensity of exercise. And the aim is to change that to suit your own needs and your own time frames and fitting it around your day-to-day life. So things to highlight is if you've not exercised before, that's okay. Okay. The recommendation is to start though, perhaps after 13 weeks gestation, and to start off gradually, sensibly, with low impact exercise and cardiovascular exercise, such as walking, power walking, or perhaps cycling, swimming, those sorts of things. We don't want you exacerbating yourself so you can't breathe. That's a key thing here. And we recommend thinking about the talk test is a good way to gauge that moderate intensity level of exercise. So can you exercise without completely losing your breath? Can you still talk in sentences whilst you're exercising? And does that feel comfortable for you? Now, if you're a regular exercise, things we want to also be thinking about are other, if you're perhaps doing maybe more exercise that increases your likelihood of bumping the bump, we say is to avoid those types of exercise. And we say to adjust them to mean that you are doing a little risk assessment for your safety during pregnancy. So exercise that we'd say to maybe steer clear of that could cause these sorts of problems with bumping the bump is things such as netball, things such as football, any contact sports, or anything that puts you at a higher risk of falling. So, for example, horse riding or skiing. But it's not to say to stop. It's to say to just modify what you're doing to still get those benefits that you feel from exercise. Other key elements to think about when you're exercising is just to listen to your body when you're exercising. And to go by what you're feeling internally is really, really important. Okay, so listen to what your body's telling you and adapt. That's the key thing. Adapt what you're doing. Don't stop. Absolutely not. As it highlights at the top there, it really points out the overall well-being benefits that you get from exercise. It helps to control weight gain in that postnatal period by helping keeping a healthy weight during pregnancy. It helps reduce high blood pressure problems, okay, and avoid the risk of developing anything such as what's called gestational diabetes that can be experienced during pregnancy. Of course, it improves your fitness or helps you maintain your fitness during this period of time. The big selling points I say to people with exercise, it improves your sleep and it also improves your mood and your well-being. We know it's a time of change during pregnancy in that year after birth. So actually exercising helps to stabilize your mood and improve your sleep to nurture your body, particularly when it's changing and developing so much during this time. And it really helps to release something called endorphins, which are your feel good hormones. Okay. Trying to think if there's anything else I've missed on that infographic. Another big key element here is that there is no evidence of harm is the big thing to stress here. If you were following that guideline there is no evidence of harm to you or your baby. So everybody keep on exercising. A couple of things just to consider when you're exercising during pregnancy is to be thinking about your warm up and your cool down. You know, you might at this time just have to really prepare a little bit more so than perhaps you do in day-to-day life normally. So think about doing some gradual warm up, whether that's just walking or whether that's you actually just doing some stretches, some exercises before you actually start your main activity. And do maybe, you know, consider, can I change to doing low impact exercise? Now, some people might not know what I'm referring to there, but low impact exercise is exercise we're not putting impact through the body. So we're not jumping up and down. We're not jogging. We're not running in that sense. We're not doing star jumps too much of the time. Can you just modify it and change it? Now, in early pregnancy, and so perhaps your second trimester, you may feel actually that you can be doing these things, but you might find that you might have to alternate to lower impact exercise as your pregnancy progresses. If it's in the summertime, warm weather, consider exercising in a cool environment. Okay, it's really important to consider not overheating at this time. So drinking well is important there. Loose clothing with layers that you can peel off should you need. Exercising in the shade, for example, where you can. Doing it at a better time of day, morning or maybe later in the day, avoiding midday if it is a warm day for you. We said about considering the talk test, didn't we? So keep that in mind, everybody. And take care, like we say, to avoid activities where you're going to lose your balance. So I referenced cycling is okay earlier, but if you're not used to cycling or where you're cycling, etc., or what type of bike you're cycling on is really important to consider as well. The other things we say to avoid really is to avoid also lying flat on your back when exercising after 12 weeks gestation, 12 to 16 weeks gestation, we say. There's a very good reason for that. And often people ask us, why is it important that I can't lie on my back? It's all to do with your blood flow to you and your baby. And when we lay on our back and as your baby grows, your fetus grows, it actually starts to put a little bit of pressure on your blood vessels when you're laying down on your back. So this is where we say that the guidance to be lying on your side, particularly your left side, when exercising or when sleeping, of course, to avoid lying on your back. The only other key things we say to avoid, and these are quite specific during pregnancy, is, like we say, to avoid the risk of trauma, avoid the risk of bumping the bum. We've said that already. But avoid scuba diving if you can, please, all to do with pressure. And also avoid vigorous exercise above 6,000 feet. So no climbing Everest, as we say. And that's really to do with your blood flow, blood pressure, etc. And so we won't go into that in any too much detail, but perhaps consider avoiding those types of holidays or trips at this time. Now, just to go through a little bit more about, we've touched on this. So what type of exerciser are you is really important. And this is where it's not black and white. It is about the individual. It's about you and what you are used to. What is your exercise tolerance? We say, so how much exercise are you used to doing? And to really, consider that when you enter into your pregnancy. Or have you been unwell in the first trimester and you haven't felt able to continue the level of activity your exercise you're doing? So then it's important to consider that when you enter into that second trimester, you've had a break essentially. So it's important to work from ground upwards again. So if you don't exercise regularly, like we said, to avoid starting that before 13 weeks and start smaller bouts of exercise more often, maybe. If you're a regular exercise, it's worth always checking in with your midwife, your GP, whoever you're speaking to, about the exercise you're doing, just as like we say, it's very individual, but maybe consider 3 times a week, 20 to 30 minutes. If you're an elite athlete and you have a great team around you to support you, then it's really important to consult them for guidance with you as well. But it's also important to consider what focus or goals you are achieving during that time in your pregnancy, and having that modification of what you're aiming for is worth discussing. Now, again, elite athletes' tolerance to exercise is going to be that much higher than the average population. So again, it's not like for like. We do need to consider that. And if you are a birthing person, or planning to be a birthing person, you have a disability, then it's really important to involve those specialists who are normally within your care to be a part of that picture, to connect with yourself, with your midwife, to kind of consider as your well-being as a whole and what guidance you have for exercise during your pregnancy. So I hope that gives everyone a little bit more clarity. There are some great resources out there to say. So Exercise in Pregnancy Foundation, I think I've said that the right way around, is a great resource with loads of different information leaflets for people. So do have a look in Exercise in Pregnancy Foundation. It's a great place to look. So have a little look at that. And I'm sure your midwifery team, your maternity team, or the physiotherapy team that's there to support you during your pregnancy would also be able to provide you further guidance should you need. So I'm going to hand you over to Zoe now. We've covered our section 1, haven't we? I'm going to pass you over to Zoe, where Zoe is going to start telling us a little bit more about a very important muscle called your pelvic floor. Now, some of you may or may not have heard of it. So Zoe, here you go.
Thank you, Jenna. So please bear with us. It may not feel very relevant at the minute, but it might be later down the line. So we really want to just let you know what it is, where it is, and some exercises to maintain it or strengthen it, or we might even just want to relax it. So bear with us here. So your pelvic floor muscles are a group of muscles that cover the outlet of your pelvis. So they attach from the pubic bone at the front of your pelvis and they go to the coccyx bone at the back, so forming the floor of your pelvis. Let's see if I can get my little laser here. So the pubic bone at the front and then tailbone right at the back. So they look very much like a hammock in their shape and they act like a trampoline to provide support. So together, they are about the size of your palms cupped together to form a bowl. So if you do that and have a look, you've got a nice visual of what you're kind of working with and what you have and what we're aiming to exercise. So if you're sitting on an exercise gym ball, you can feel the area of your pelvic floor in contact with the ball. So from your sit bones left to right, and then to your pubic bone and coccyx, so front to back as well. So our pelvic floor has 3 openings in it, which allows the following passages. So we have the urethra, so around here. So this is our wee pipe. It lets us pass urine out from our bladder when we have a wee. And then we have the vagina. So this is where we have sex and can birth our babies vaginally as well. And then we have the anus. So this is the very end of the rectum and the bowel as well. And this is where we poo from. So the anus has a very strong sphincter or circular muscle at that point, which makes up a big part of our pelvic floor. So it's just to be aware of that as well. So we've got a nice view here from the front. So if we chopped you in half, took away all the soft tissues and organs, and that's what we're having a look down at. And then as you can see during pregnancy, this is kind of the impact of what's going on and the pressure that your pelvic floor muscles are under through that ever-changing 40 weeks of pregnancy. So the pelvic floor muscles have several important roles that we're really grateful for. They are definitely highly underrated muscles, and we are their biggest cheerleaders, or some of them. So let's tell you just a little bit more about that. What are these muscles doing? So they help control our bladder and bowel, so they prevent leakage. They're supporting our organs, so they're preventing prolapse or pelvic organ prolapse, if that's a term anyone's heard. And it improves sexual intercourse and orgasm, so they help with sensation. It provides support to your back and pelvis, so it's part of your general anatomy. It's helped keeping you upright and stable. And it assists in delivering your baby as well, so it enables you to push in labour. So very important roles there, and that's why we are their biggest cheerleaders. So we've got a couple of analogies here. So we've got a tap, first of all. So when squeezing tightly, the pelvic floor acts like a tap. So it's stopping any leakage of wee or poo from the bladder or the bowels. So that's kind of something you can imagine and visualize there. So we have a boat as well. So you want to imagine a boat in a dock, and the boat refers to your pelvic organs, so your bladder, your womb, and your bowel. So water is your pelvic floor, which supports your organs, so your boat, keeping that up. And imagine that your boat is tied up in the docks. So these will be your ligaments. When there's a lot of water, in the dock, i.e. you've got a strong pelvic floor, the organs or boat is well supported. However, if it's low tide and the pelvic floor is weaker, the boat will sit lower in the water, so there is less support for the organs and put strains on the ropes and ligaments. So we don't want your boat to sink. This is that analogy there. We want everything on an even keel, so it's all working to function. And our very last visual aid here is our hammock. So this acts like a shock absorber or cushioning for your pelvic organs under pressure. So your pelvic floor is constantly adapting and changing to what's going on in your day-to-day, and it's providing that tension and that support to your organs. So it's really an important role. So I'm just going to hand over to Jenna.
That's really great. I love those analogies. They really help just to understand a little bit more about a muscle that we can't see very well, and we don't understand because we don't have that visual input, do we? Like we do with other muscles where we can see how well they're working. Just to carry on with what you were saying about birthing your baby, I think it's a big misconception, isn't it, that people have thinking, well, if I strengthen my pelvic floor, I have a strong pelvic floor, surely that's not going to help with birthing my baby. But what we know is a pelvic floor that's working really well actually helps them have a platform for the baby to pivot on when you're crowning, when you're birthing your baby vaginally. So just wanted to add that in there.
A big taboo to break there, isn't it, Jenna? And something we hear a lot of, definitely. So if the pelvic floor muscles are not working as best they can, they're either being too weak or too strong, the following symptoms can be experienced. So if it's too weak, the pelvic floor may not close that tap fully shut and cause leakage of wee, wind or poo from the openings. Again, if it's too weak, the pelvic floor may not be able to do its supportive role, as well as causes our pelvic organs. So if we're thinking about our boat analogy again, they can sit a bit lower and be less supported. So this can be symptoms of pelvic organ prolapse. And again, if weak and less nerve supply to the muscles, there can be a loss of sensation, and orgasm can be affected as well. So if we switch that round, if it's working too hard and tightening too much, there can be pain and discomfort. So these are some of our common symptoms associated with that. So why is it important to care for our pelvic floor? So because these symptoms can be common, the statistics highlight this on the screen. One of our aims of today's session is to highlight, yes, they can be common and abundant, but it's also to highlight that we shouldn't normalise this as part of pregnancy and after birth, and we shouldn't have to put up with these problems. So they're common, but we don't want to normalise them. That's a take-home message. We instead want to support and empower you after today's session to know your first line advice and tips and where to get support should you need it as well. So I'm going to hand back over to Jenna.
Wonderful. Thank you, Zoe. Just to add on to what Zoe said there, it's all about prevention. We know that pregnancy and childbirth can be one of the main reasons that women particularly experience pelvic floor weakness, pelvic floor dysfunction, we term it. So we've a pelvic floor muscle not working right in some way. So we want to target everybody at this time and highlight that there is so much evidence and importance of exercising your pelvic floor at this time to prevent problems lifelong in the future. So when you're listening to this, you might think, well, I don't have any symptoms. This is irrelevant to me. I don't have any problem, but that's it. You are the right person to be listening because we want to make sure we're giving you the information, empowering you with this guidance to do your exercise program for your pelvic floor. But also, if you are experiencing problems, it's really important that you do mention it, you highlight it to whoever's around you from the health professional team, so midwife, GP, or trying to self-refer directly into physiotherapy, which we'll talk a little bit further about down the line. Because we have so many women who we see later down the line saying, I just wish I did my pelvic floor exercises because I now can't jump on the trampoline with my kids, or I take them to the trampoline park or the soft play, and I can't charge about with them, and I'd really like to. So that's really our message for everybody today. So let's talk about exercising this pelvic floor now then. So as I said, there is a wealth of evidence that pelvic floor exercises during pregnancy and after pregnancy and even lifelong can help prevent these issues, but they are also the first line treatment for any of those problems that Zoe highlighted a moment ago. So it's the first thing to be doing with lots of evidence that they're necessary. So just before I go telling you about how to be doing them, maybe sit there or stand there, or wherever you're doing, however you're listening to this recording, and just think, I'm going to squeeze my pelvic floor. And just take a moment to think, what am I actually squeezing? How do I know I'm squeezing? Has anyone actually really told me how to be doing these? Or am I just guesswork, piecing it all together? Not to worry. Okay, so if you're not sure, you are not alone, is the message here. We know that if you just told somebody how to do their exercise, or if they just assumed from piecing things together, that we know actually about 65% of people are actually doing them wrong, even though they think they are doing them correctly. So to stress, if after today, for any reason you're struggling still with exercising your pelvic floor, it's important to see a pelvic floor physiotherapist who has the skills and the abilities to assess your pelvic floor and identify how well it's working. But hopefully after today, you're going to have a lot better idea how to exercise these muscles independently moving forward. So we're going to go through that in some detail now. So let's just play a little video that's going to run through that for you. All of these videos are available to you as well on the Just One Norfolk website. We have a pelvic health during pregnancy page, and we also have a pelvic health after pregnancy page with lots of different 1-minute helpful videos to support you with pelvic health.
Pelvic floor exercises during and after pregnancy. The pelvic floor muscles sit between the pubic bone and the tailbone. They sit around the back passage, vagina and opening of the bladder, maintaining bladder and bowel control and supporting the pelvic organs. Pregnancy increases the load on these muscles, so strengthening the pelvic floor during and after every pregnancy is essential, whether you've had a vaginal or a caesarean birth. To do your pelvic floor exercises, squeeze and lift the back passage as if you're trying to stop wind, then continue the squeeze and lift to the front as if you're stopping the flow of urine. Try not to hold your breath or contract your buttocks or legs. Let go fully after the contraction. Repeat long contractions, lifting and holding the muscles for up to 10 seconds before releasing. Give yourself 5 to 10 seconds rest between each contraction. Aim to do this up to 10 times or until your muscles tire. Then repeat short contractions by lifting and releasing until your muscles tire, which may be up to 10 times or more. Do the short and long pelvic floor contractions 3 times a day, starting as early as you can in your pregnancy and continuing after having your baby, once any catheter has been removed. Using the NHS Squeezy Pelvic Floor app is a good way to gain motivation and guidance.
Love that video. Gives a lovely little recap, and we're just going to go over that a little bit more in detail, and also in a moment talk to you about the Squeezy app, which is available to women during pregnancy and after pregnancy if you live in the Norfolk and Waveney area. So how should I squeeze? Let's go over that. Let's just break that down a little bit more. So we've gone through the anatomy. We've had our little biology lesson, haven't we? Learning about what our pelvic floor looks like. So remember that. Remember what areas we're trying to squeeze around. We have those 3 holes and we're trying to squeeze around those 3 holes. So we're going to imagine that we're trying to squeeze around the back passage first and we're stopping passing wind. So we've all been there. We've all been in that moment where we've had to hold a fart in, where it's been inappropriate or socially not acceptable to be letting it out. Say you're in a weight room, it's really quiet, you don't want to let it go. That's your pelvic floor. That's that big sphincter muscle around your pelvic floor that helps you control wind. So squeeze that, squeeze it. Then also think about moving slightly further forwards and squeezing around the vaginal area. So can you squeeze there? Imagine like you're gripping during intercourse, during sex, or imagine, sometimes if we have a tampon that's in place, that's perhaps not, or that's not quite in place, and you kind of want to squeeze to pull it in a little bit more. That kind of sensation. You then move further forwards, working from back to front here, and you're going to squeeze as if you're stopping yourself going for a wee. So that feeling like you're desperate to go, but there's a queue in front of you in the toilets and you just need to hold on. Again, we've all been there. We all know how to use this muscle when we need to. Then the important thing is once you've squeezed and closed everything off is to lift and feel that internal lift and sucking up is the way I describe it inside. Now you're not moving physically outwardly. No one can see you moving, but it's that sensation of pulling up and in inside is what we want to feel. I sometimes describe it as imagine you've got a zipper from the back passage to the front, moving from back passage forwards to your pubic bone, squeezing, zipping everything up and lifting internally, drawing up inside. Now, one thing you don't want to do is what I'm doing now, which is clenching your buttocks. That is a very different muscle that's not going to strengthen your pelvic floor. It's going to give you toned buttocks, but not a toned or strong pelvic floor. How often should you do them? As we said in the video, 3 sets a day, please, if you can. 3 times a day, you're going to do the 2 different types of squeeze. And this is all about the length of time that you hold them is the variation of the 2 types of squeeze. So let's just go through the quick squeezes first of all. You want to do these to help the pelvic floor when it's under pressure. So when you cough, you sneeze, you laugh, that pelvic floor has to suddenly hold on to stop any pressure on your bladder, to stop any leakage, essentially. What you want to do is do like a ready, steady, go, squeeze and release, have a rest. Ready, steady, go, squeeze and release and have a rest. And this little diagram here has a beautiful example of that. Okay, so we're just going to do that again. Ready, steady, go, squeeze and release and rest. Squeeze and release and rest. Squeeze and release and rest. Now you can try and increase the pace of that as long as you're getting that rest in between is really important. Sometimes people do them so quick that they're not going all the way up, all the way down, back to baseline. But you can try and test how quickly you can do that, but everyone's going to be different. And you might find during your pregnancy that you actually might have to slow that down as it feels a little bit harder over the course of time because your baby is growing, putting pressure there. Let's go on to the long ones then. So this is slightly different, but a nice little graph here. You're going to do a squeeze and lift. You're going to now try and hold it. You're going to keep it held all that length of time. Then you're going to lower down and release. and then you're going to rest for about the same length of time that you've held the squeeze for. Let's say 10 seconds is what we're going to aim for, okay? We're going to have that break. We're then going to squeeze and lift all the way up as strongly as you can, lifting, drawing up inside. You're going to count, and you're going to try and maybe count out loud because it helps you breathe correctly as well. We must make sure we're breathing through our exercises. We're going to rest and release all the way back down. We're going to pause again for the length of time you've held. So if you've held for 10 seconds, I'd say you rest for 10 seconds. But the key thing here is to do what your pelvic floor can do. There's no point in holding for 10 if you felt that the muscle has already let go. So you might find if it's a bit weak, or if it's recovering after birth, you might find you can only do a few seconds at that time. And so you stick with that. You just stick with 3 seconds, rest for 2-3 seconds, and work on that. And gradually over time, you will be able to hold for longer. Okay. Key bit here that says in that grey section there with exclamation marks is the muscles need to get tired. You have to work them hard, same as any other muscle. When we're exercising the gym, because we might want to get stronger or bigger muscles, then we have to push, we have to add weights, we have to work hard to make those muscles work. And we have to do them in sets and reps. So that's why we're doing 3 sets a day. And we want to try and make the muscles work hard. So we want to try and maybe do them maybe in a position that makes them work hard. So potentially if you're finding them easy sitting down, then maybe try them standing up because that's harder, for example. Whereas if you're finding it's actually quite hard work to do them, you can't feel you're doing them correctly, then maybe lay down, for example. So listen and feel what's happening with your pelvic floor to work out what's right for you. And that might change over time and work with that. Then in terms of, we haven't got any questions because we haven't got anybody on the other end of the call today, Zoe. But hopefully that's helpful to have a bit of an idea. But Zoe, is there anything you want to add in, or I might let you take control and see if you want to throw up any questions that often people ask us about pelvic floor exercises?
Absolutely. So it's definitely a different area, and a lot of the time we don't really know about it until pregnancy and that after pregnancy stage. So it is
agreed.
Bear with us. We've got some really commonly asked questions. So we'll run through a few of these, and hopefully they're just going to adapt and enhance your knowledge and how you're doing things. Okay, so question number 1. I always hold my breath when I'm doing my pelvic floor squeezes. Should I be? So
I may have touched on that, mightn't I?
Yeah. It's a no. So we really encourage you to breathe out as you exercise. So it's really hard when you're trying a new skill and you're learning something. We're concentrating and we do tend to hold our breath. It's just something we sometimes naturally do, but we encourage you to breathe. And there is reasoning why as well. So we're going to add another layer onto your pelvic floor exercises to incorporate your breathing. Okay, so as you can see here in this diagram, our diaphragm and pelvic floor muscles, they're kind of working in sync without us even really knowing this is going on. So when we take a breath out, the pelvic floor muscles rise, and when we breathe in, they relax down. So that's just something to bear in mind, which is going on in your general anatomy day to day without you knowing. So what we want to do is squeeze or close the openings before you exhale. So we're going to squeeze. Let me start again. Take a breath in. And on that exhale, we're going to squeeze and lift as we are blowing out. So we're just really engaging your breathing and your pelvic floor exercises. With this, you may feel that your lower abdominal muscles are kicking in and working. So they may tighten. So this is really just giving you that extra top up and extra efficiency with these pelvic floor exercises you're doing. So breathe in, and then we're going to breathe out, squeeze and lift. And as you're holding that, if you're doing your long holds, we then just want you to continue breathing. So we're not asking you to hold your breath. I'm going to let Jenna jump in here now as well. So this is just adding that another layer onto breathing and pelvic floor exercises. All yours, Jenna.
That's perfect. I was just going to add when you're closing off, to say that they really help that technique when you're doing your short ones. So trying to do that relax your pelvic floor as you're breathing in, and then even do a quick, short, sharp blow out of your mouth when you're doing your short squeeze. So breath in, relax, short, sharp breath out. And that helps you to really contract it really tightly. Breath in nice and slow. Imagine there's a big balloon in your belly, relaxing your tummy and your pelvic floor. Quick, short, sharp breath out. Yeah, and you can try and obviously do the pace of them quite quickly. And then when you're doing your long ones, start that lovely long lift and squeeze your pelvic floor with a lovely long breath out. So sometimes I even say do a nice long S breath, like a nice long shh. And then when you're holding it, you need to keep breathing though. So don't stop breathing at that point. Keep breathing while you keep that pelvic floor lifted and held. And then nice big breath in as you let it go. It really switches that pelvic floor off.
It's brilliant. And it just gives you that extra 10%, doesn't it, Jenna? It gives you that extra oomph to help lift that pelvic floor as well.
It really, really does. So do remember those techniques. It is like patting your head and rubbing your tummy. And you can even see just then I struggled to do that. So it is worth trying to overcome that challenge. Yeah.
So another commonly asked question we have is, I've been told to do them whilst trying to stop the flow of wee. Is this right? So our answer to that again is no. You can imagine you're trying to stop the flow of urine, but we do not want you to do it whilst you're having a wee. This can cause a lot of bladder confusion because your bladder empties under your brain's control. So we don't want to be saying we're switching you off now whilst you're having a wee. And it also, when in pregnancy, you're at an increased risk of developing urinary tract infections. So we also want to minimize any risk to having any urine left in the urethra or in the bladder, which could potentially cause any infection as well. So we say, imagine you're stopping having a wee, but please don't do it whilst you are actually actively having a wee. So what increases the likelihood of having pelvic floor issues? So this is quite an important one. So this slide here, so we just want to inform you of these factors so you have the information and that empowerment to know if you fall into one or more of these categories, which may increase your risk of pelvic floor dysfunction. So it's just really useful to know. So the number of births is going to, I'll let you jump in, Jenna, as and when.
That's fine.
Shall I let you explain some of these?
Go on, you say number of births, you carry on, and I was going to jump. I'll go into the pelvic floor related to childbirth ones. You carry on for the pregnancy.
Thank you. So the number of births, so the more vaginal deliveries or more pregnancies you've had, that is in turn going to be increasing that pressure on the pelvic floor over a time period. And again, over the age of 30 is a factor as well. So our muscles change, our hormone balances change as well as we get into this 30 plus category. So again, it can impact your pelvic floor health. So I'll hand over to Jenna to look at the factors.
Amazing, brilliant. So related to childbirth, a few elements that can impact our pelvic floor longer term is if we've had a vaginal birth where we've had an instrumental delivery. So a forceps delivery or a vacuum delivery can have more impact and need more recovery after birth than that's one that's not assisted delivery. And also we're going to talk a little bit more about perineal tears in a moment. So we're going to go over that a little bit more in detail. But to touch on that at the moment, a 3rd or 4th degree perineal tear. So there's 4 degrees, 1st, 2nd, and 3rd or 4th. So 3rd and 4th degree tears can have a more of an impact on your pelvic floor longer term as well. Another factor can be if you've got a larger baby. So if you know you're measuring larger with your baby, that can have an impact, and that's why the discussions are had around your birth choices as well.
So we have some general health factors as well that may affect your pelvic floor muscles. So things like connective tissue disorders, Ehlers-Danlos syndrome or hypermobility can impact on your pelvic floor muscles. Is there a family history of urinary or bowel incontinence? Has your mum, grandma, anybody had a history of that you've heard of before? And again, the same with prolapse symptoms. So again, family history of that is something that you're aware of. It's not always discussed, but it's something to consider. Chronic coughs. So again, this is putting a lot of pressure through that pelvic floor muscle if you have a long-term cough, and it's just another factor to be aware of. So BMI plays an impact. Are we carrying an excess weight? So this excess weight is also going to impact our pelvic floor muscle. Lack of exercise. We really encourage exercise and using muscles. And constipation can have a long-term constipation can have a big impact on your pelvic floor muscles as well. If you're having to strain and you find there's real difficulty with bowel evacuation or having a poo. Diabetes as well in either long-term or pregnancy, and smoking as well, because it can affect muscle health and healing. So let me skip. So I forget to do my pelvic floor exercises. What can I do? So this is a very common thing that we hear and we come across. It's difficult to get into a routine, and that's something that we love to express and get across, that if you can get this into your daily routine, it's likely you will be more successful in fitting this into your day-to-day life. Some of our top tips for this is hopefully brushing our teeth twice a day. So that's 2 times we can get our pelvic floor muscle exercises in. Hopefully having 3 meals a day as well. So if you're a good multitasker, can you do it whilst you're eating, or can you just sit for 5 minutes after your meals and just do a set of pelvic floor exercises? Thinking about that postnatal period when you're feeding your baby and having cuddles or skin to skin, is that a good time to fit a set of pelvic floor exercises in? And if you're busy, you're on the school run, you're driving to work, doing the food shop, and there's always traffic lights that can stop us en route, is that a good time just to fit a set in of pelvic floor exercises? And some people just like the basic post-it notes around the house, on the fridge, on the kettle, do your pelvic floor exercises. So it's just do what works for you, fit it into your routine, don't let it add too much stress, but get it into your daily life. Another really good one is our Squeezy pelvic floor app. So the Squeezy Connect app is a pelvic floor muscle training app, and it is free to download to all during and after pregnancy who are registered under Norfolk and Waveney. I will let you jump in, Jenna, as well, just to make sure that if
Absolutely.
are difficulties with it and you don't have access to the Squeezy app, or there was difficulties downloading it, you can email us, and our email address is nwicb.perinatalpelvichealthservice@nhs.net. So please do email us and we will support you with getting you onto the app if there's been any difficulties. One big thing we do encourage is to change your personalised exercise programme once you've downloaded it, because the settings won't be there for you, okay? So what we say, when you've logged in, you want to go on to the exercise plan, which is your green leaf here. And then on there, you can change how many repetitions you're doing, how long you can hold the squeeze, and how long you set your relaxing time for as well. And that makes all the difference in using that app.
I was just going to add in there to say that if you are unsure how you access it, if you're eligible, then please speak to your midwife is the best way probably as well if you're not sure. So do speak to them and they can give you a little bit more guidance, or even put you in touch with us as well, should you need.
And we've also got links on Just One Norfolk as well.
Absolutely,
so
yep.
We're out and about.
So I think that comes to the end of our section on pelvic floor exercises. It has dominated quite a bit of this session, but it's because it's so important and because we know that so many people aren't aware of it. So hopefully you've taken something away from the importance of your pelvic floor exercise, and hopefully you've been squeezing whilst you've been listening to us talk. So we're going to move now on to a little bit about the changes that can happen to our bladder during pregnancy and what can be common. What I might do if I jump in on this slide then, if that's all right, Zoe.
Absolutely.
So bladder changes. I'll just take control. Sorry, bladder changes in pregnancy. We have a lot of changes that happen. You might have noticed that already if you are pregnant, and there can be multiple reasons why that is the case. Okay, so our body's going through so many amazing changes at this time. Absolutely phenomenal what our body can do at this time. One of those reasons can be due to hormonal changes. One of those reasons can be due to having more blood volume to support you and your baby at this time, which means you have more urine that you wee out. So there's real variations in different reasons. It could also be that as your baby grows, there's more pressure on your bladder. There's less room for your bladder at this time as well. So all of these reasons are normal and expected and a part of pregnancy. Okay, so you might find that you're therefore going to the toilet more often. You might find that there's a little bit more urgency to go, and you're going more regularly during the day and even during the night as well. Okay, so that is expected at this time because, like I say, all of those reasons above. What can also happen is, particularly in the later stage of pregnancy, or unfortunately, if you've experienced anything like being poorly or excessive vomiting in the early stages of pregnancy, you might find while that bladder is under pressure that you're actually having an element of leakage as well, or urgency during activities such as coughing and sneezing or lifting, bending. And that's again can be expected and very common. About 2 out of 3 people can have these problems in later stages of pregnancy. Okay. One thing to stress though is if you are having that leakage, it does increase your likelihood of having these problems afterwards. So again, raise your hand, tell somebody about that problem. Make sure you're seeking help in pregnancy if you're noticing you're getting that leakage, because we want to make sure we're doing all we can to reduce that being a longer term problem for you. Okay. The other thing that may be common when you're actually going for a wee is the flow of it might feel different, because again, that kind of pathway, that little pipe work that comes out from your bladder might be being slightly affected in the position. And again, it's normal, that can happen, but you might find the flow of your urine is a bit start and stop, it's a bit slow, or it might be fast. It can, again, all within normal. We do want to make sure, though, that you're able to empty your bladder. So again, making sure you're able to wee every few hours is really important. Every 2-3 hours is a really good gauge to know that that's normal and that you can be doing that. It can also be likely that you're an increase of something called a urinary tract infection, or sometimes terms a bladder infection maybe, but a UTI, that's what we often call it. And that's one of the reasons your urine is checked regularly at your appointments as well, to check for anything. So we're going to go on to a slide now about the symptoms of having a UTI, just things to watch out for. The things to watch out for if you think you might have a UTI is a sudden need to pee, a feeling of pain or burning sensation before, during, or after weeing. Even symptoms of generally feeling unwell, or a temperature is a general sign of infection, isn't it? You may notice that your wee is cloudy, or it's a bit thicker in that sense, or you may notice there is an offensive smell to your urine once you've been. And you may also notice again that ability to empty might feel a bit different, or you feel like you need to go and you can't go. If you've got any concerns with this, we do direct you to see your midwife or your GP. Okay, no pelvic floor exercise is going to help with that, not our bag. So do make sure you get help with that, and they can get you appropriate treatment to support you with any of those symptoms. In terms of bladder changes, we said during and after pregnancy, it can be very common to experience that stress urinary incontinence or stress urinary leakage that we talked about a moment ago. So when you're coughing, you're sneezing, you're laughing, you're jumping, anything like that, can be about 2 out of 3 people, sorry, can have it in the late stages of their pregnancy. And about a third of people can still experience these symptoms after birth. It can be common, but we don't want to normalize it. We don't want it to be something that you just put up with longer term. Okay, so a big area to treat that again is your pelvic floor exercises, and supervised pelvic floor exercise by seeing a physio for that one-to-one support. So stress urinary symptoms, as I've said there, things that can help are those pelvic floor exercises. Start them, do them during your pregnancy. If you're struggling, seek help. Something else that can help is called the knack. So it's basically, it sounds a fancy term, but it's just using your pelvic floor when you need it. So if you know you're about to sneeze and cough, and you know there might be that element of dribble leakage, then try to squeeze your pelvic floor. Pull that zipper up, close those openings, lift up your pelvic floor and keep it held whilst you're doing that cough or that sneeze or shout or wherever it may be. And you'll find that that is quite successful in helping reduce that leakage. It's a really good quick management strategy to help with that. Other things you might want to consider if you're having that leakage is look at what it is that's causing it. So if you are leaking when you're lifting things or you're doing a certain type of high impact exercise still during your pregnancy in that later stage, you might find that actually that's something you might want to look at modifying and changing what you're doing because it is causing that symptom and causing that pressure on your bladder and pelvic floor. Zoe, shall I pass you over to some of our bladder happy top tips? These are things we say just to think about, be more mindful of during your pregnancy.
Absolutely. Thank you, Jenna. Yeah, so our bladder top tips, things that you can proactively do just to help keep your bladder happy and keep everything functioning well. So we say drink plenty, and by this we're saying from about 1.5 to maybe 2 litres of fluid a day. So we want you to drink to thirst, but be aware that you can potentially drink too much. So if you think, I'm having about 3, maybe 4 litres of fluid a day, then the reasoning we say just watch how much you're drinking. Sodium acts as a gatekeeper for balancing your fluid entry and exit in your cells. So low sodium can allow too much fluid to enter and can prevent your body from working normally. So it can affect baby's fluid balance as well. So if you're drinking excessively and you just have an unquenchable thirst and it's new, we definitely encourage you just to contact your midwife for advice about this. So we do say sit forward on the loo when you're having a wee. So this lady here demonstrates this beautifully. This is what we'd say is a really good position to sit and have a wee. So relax your tummy, elbows on your knees, and you can see that the back position here as well. So it's kind of what we'd say adopt as a good voiding, weeing position. So if you find actually that you may retain a little bit of wee after you've been, we do encourage you to rock on the loo after finishing. So if you go forward and back just to see if that's enough, just to help get that last little bit of residual wee, the last bit that's sitting there. You can go side to side if you feel safe to do so, and you can stand up and you can just tuck your tail in or just do that motion and sit back down again just to see if that helps move anything that's not come out essentially. So we do say avoid caffeine, and there are limitations on caffeine intake during pregnancy. There is advice for that. But again, caffeine can be a real bladder irritant and it can make you get urgency a little bit more frequently than if you'd had, say, a glass of water or a glass of milk. So just be aware that some people can get a really irritated bladder as well with that. And again, our top tip would be the knack. So if you've got time to put your hand up to cough or sneeze, you've hopefully got enough time to quickly tense and lift that pelvic floor whilst you sneeze or cough. So that would be a big take-home tip there. So I'm going to hand back over to Jenna for bladder health in labour.
Wonderful. Oh, excuse me, losing my voice. Sorry. Yes, so we're just going to go through a few little elements about considering your bladder during labour, and it's often something that might not be the first thing on your mind. So we just want to have that discussion ahead of time, just to think about what we'd encourage to consider during your labour. Now, you should have these conversations will likely come up with your midwife later down the line when you're having birth choices discussions. But important things to consider is continuing that good bladder health during your labour, as it may be a period of time. So think about the importance of emptying your bladder as normal every 2 to 3 hours. Is really something we suggest to be keeping an eye on. Now, again, it might not be the first thing that's on your mind. So is it something we can actually put in your birth plan for your partner to even to have that discussion with your birthing partner to consider about your bladder health and keep an eye of, are you going to the toilet regularly during that time? And even for them to be able to communicate that as well if they've noticed that there are any problems with that. Something to expect during your active stage of your labour is that you will have a fluid balance chart that will be provided to you and that your midwife or health professional will be helping support you with. And it's again something your partner can assist with, keeping an eye on what you're drinking, charting down how much it is that you're drinking, and also the midwife will be keeping an eye on how much you're weeing and how much you're passing urine. Okay. It's also something very common to consider to have a catheter after birth. And it was, I think, discussed a little bit on one of the previous videos, but a catheter can be very normal and it's there to protect your bladder and to just monitor your urine output after certain types of birth. It might be quite common after it is standard after a cesarean section or after an instrumental birth as well. And other reasons as well can be why you may have a catheter. Just to highlight, a catheter is painless. It shouldn't cause you any problems. It's something that just allows you the chance after birth to relax and not need to worry about managing emptying your bladder at that time. Okay. The reasons we say it's really important to empty your bladder during labour, so our selling points to you on this, is that it actually allows your baby's head to descend into the pelvis. If you can imagine that there's a full bladder or a full little balloon in the pelvis and your baby's trying to navigate past that, it can actually cause some difficulty. So that's a big reason why it's really important to assist you in labour to have good bladder emptying and also good drinking as well, of course. It's also important because it can actually help your contractions to be more efficient if you do not have a full bladder. A full bladder can actually maybe impede those contractions that are necessary to help progress your labour. And yes, I think that's the summary I wanted to touch on there, is that it can assist with that more timely delivery of your baby, but it also can avoid any longer term issues with your bladder. Sometimes if the bladder is getting too full and not able to empty, partly because labour is midway underway, then we want to make sure that we avoid your bladder getting overstretched, which could potentially cause longer term problems. So it can be very common after birth that you are asked to measure your urine afterwards, because we want to make sure that your bladder is contracting and emptying and giving you that awareness that you need to go. So that's something to expect afterwards, that you'll be asked to just tell them about emptying your bladder. And it's really important that you get that either 1 or 2 measurements done before you are then discharged, etc., from hospital if you are in hospital. Okay.
After birth week 1, bladder care. During labour, you should pass urine regularly every 2 to 4 hours. If you have any concerns, please speak to your midwife. During and following birth, drink small amounts of water regularly rather than having a large volume all at once. After birth, or having your catheter removed, you should have passed urine within the first 6 hours. It's important that when you first pass urine, it's measured by the midwife. To help pass urine, sit on the toilet seat and relax. It might help to run some water or gently tap over the bladder. Some women have difficulty fully emptying their bladders after giving birth, which can lead to long-term issues if not identified. In this case, your healthcare provider may advise that you have a catheter for a short period of time to allow your bladder to rest and recover. Remember, it's important to avoid constipation and straining. It's important to tell your midwife if the sensation to empty your bladder is reduced. You can set a reminder to urinate every 2 to 3 hours to help with this. If you have difficulty emptying your bladder, if you've not been able to pass urine within 6 hours of birth or catheter removal, or if you notice that you're leaking urine, particularly when standing and moving around.
Super. So that is everything we have to talk about our bladders. Now, to move from one bodily function to another, we're going to talk about more about our common bowel symptoms that can occur during pregnancy and afterwards. So again, these might be sensitive things we might not even be aware to raise to your health professional or to consider that it would have an impact on you. So we're just going to go through a little bit about those now. Zoe, did you want me to head on with this or would you like to?
I can start. Yeah, definitely.
Go for it.
Yeah, do love a bit of bowel support. So constipation in pregnancy is very common. So normal bowel function can vary for you as an individual. So it could be you have 3 movements a day, or it could be 3 times a week. So it's very individualized to what is normal for you. There are lots of impacts on our bowels during pregnancy, and it can be one of the first early symptoms of pregnancy is if people start finding symptoms of constipation. So some of these impacts are hormones. So increased progesterone early in pregnancy can slow down that smooth muscle in the bowel, which is responsible for our gut movement. And then there's peaks in the second trimester, or relaxing peaks in the second trimester can also have a similar effect. So it can turn and change through pregnancy, and through that time you may notice different impacts on your bowel health. Iron supplements can also impact on constipation as well. So again, it's just something else to be aware of. If it's prescribed, we encourage you to take it. Just be aware on your bowel health, and we'll give you the top tips to help encourage normal bowel movement for you and to help keep things flowing through to minimize constipation. And again, diet and fluids really impact our bowel health. So if we're not getting fruit and vegetables, fibre in, and we're maybe not drinking enough fluid during this time, this can really impact on what's going on down with your gut health. So we just really want to raise awareness of that. So you know what you can do to, as your first line defence, what you can do to support things functioning as normal as possible. So effects of constipation can be pelvic floor weakness. Now, I think we're normally talking about constipation over a longer period of time. If we're having to strain and really try and evacuate our bowels with a little bit of force, it can potentially cause a bit of weakness in that pelvic floor muscle. So it's just something to be aware of. And this is where we hopefully want to increase your fibre, fluid, light exercise. And if this doesn't help, then seek support from your midwife or GP for constipation management. Hemorrhoids as well can impact on constipation and maybe how it feels to have a poo. It might make us want to defer going to the toilet. So again, just have a little think about that. How can we manage these things? And if we are suffering with constipation, this can have a bit of a knock-on effect onto our bladder and involuntary leakage of urine as well. So it's not a lot of space in that pelvis, and things can have a bit of a knock-on effect either side. So please be aware of that. And again, pelvic organ prolapse. So this is something that can impact. So it's just being aware that it's almost that bit of a ripple effect, I suppose. So moving on to our happy bowel top tips, things we want to tell you about so you've got your first line defense of how to manage your bowels. Get to know your poo, okay? Very random thing to say, but are you in a routine with your poo? Do you have a certain time of the day you go? Does it feel like it's the same consistency? And are things changing in that or not? So just really get to know your poo, get to know your routine, when is good to go for you. We also really encourage you to go when you need to go, when your body is saying, now is the time to have a poo. If we are deferring having a poo, which sometimes, you know, life is busy, there may be other things going on at that time and you think, I can absolutely not go now. What we want to encourage you to do is go when you need to go. And the reasoning for this, if we're deferring, we're telling our body, nope, we don't need to go. And sometimes our bowel will reabsorb that moisture out of that poo that's sitting there waiting to come out. So with this, what we encourage you to do is go, because if we're not, that may cause constipation and that hardening of the stool, which we want to avoid. So again, balanced diet, get that fruit and veg in, wholemeal bread, get that fibre. Fibre is really important to support your bowels, so we really encourage that. And fluid plays a big part again, so keep that fluid, keep that hydration regular to support your bowel health. And don't rush. It's the hardest thing in the world, and I know it's easy to say, but allow yourself that safe place and time to go and empty your bowels, evacuate them, and have time to poo, essentially. Another thing we do encourage is a poo step. So these are great, and it helps us get into the correct position to have a poo. So our toilets are brilliant. but they are sitting us at about a 90-degree angle. And we're designed naturally to squat to empty our bowels. So if we've got a footstool, we're allowing our knees to sit a bit higher than our hips. So this has given us a bit more of an optimum position to empty our bowels. You can see here as well, this model has a beautiful belly bulge. So they're not tense in their tummy, they're not straining, they're relaxing. So that is also really going to help with emptying your bowels. So we really encourage that optimum position, relaxation. And if you feel like you need to just take some deep breaths whilst you're having a poo, absolutely do it. Light exercise as well can really help encourage you to have a normal routine with your bowels. So we do encourage light exercise, especially during pregnancy as well, as we said at the beginning. And if it's going on and you can't get a handle, you think, I've done all this first line advice and things aren't getting easier, then we absolutely encourage you to speak to your health professional about constipation management. They're aware of this, they know it's a symptom, and they'll be more than happy to help you as well. So we do encourage you to seek that support. So that's kind of it for our bladder and bowel top tips. So we are moving on to perineal tears and perineal massage. So I'm going to hand back over to Jenna for this one.
Thank you. Yeah, I hope you've taken away a few bits from the bladder and bowel health section. Certainly one thing I advocate for is that footstool, great use, and you're going to need it in later life for toddlers, so perfect to buy one. So now moving on a little bit about how to protect our pelvic floor health, how to protect our pelvic floor by looking at ways to reduce the likelihood of experiencing perineal tears. But the first thing I want to highlight is the likelihood, how likely are they? And to give a little bit of clarity on what they are, what are we talking about with perineal tears? So what we do know is that 9 out of 10 first-time mothers who are having a vaginal birth will have a degree of tear, graze, or an episiotomy. Now, an episiotomy is a cut that's made to the perineal area to assist you with birthing your baby. So an episiotomy is often performed in this sort of angle over the perineum, which is the area between the vagina and the back passage. But what we can look at is the degree of tear that can occur. So we have 4 degrees, as we mentioned earlier. First degree tear, which is just looking at, involves the skin and really the superficial surfaces of the tissues that may or may not require stitches. The second degree tear is where it more maybe affects the muscles and they will quite probably require stitches. A third and fourth degree tear is actually when it extends into the sphincter muscles around the back passage. So there's lots that can be done to help progress your labour and to reduce the likelihood or severity of those tears that occur. I'm very pleased to say that the likelihood of a third or fourth degree tear is significantly less. It is about 6 out of 100 women giving birth for the first time vaginally, and 2 out of 100 women who have given birth vaginally previously will have this degree of sphincter tear. You will, at this time, should you experience these problems, be supported by your health professionals and multidisciplinary team, including that referral to a physiotherapist and specialist medical trained professional afterwards as well to support you with managing your care. Let's have a little look now then about what we can do, how we can empower you to help support you with reducing these severities of tears. On this page, you can see there is a QR code and also a link that goes to the Royal College of Obstetrician and Gynaecologist page on perineal tears during childbirth. It has a good leaflet on there that talks you through reducing the likelihood of tears and perineal health during and after birth. And you should also receive a leaflet about perineal massage from your midwifery team around the time where you're having your birth choices discussion. So all of this will be to come if you're not quite there in your pregnancy yet. But something that can support you is what's called perineal massage during pregnancy. This can commence from about between 34, 35 weeks in your pregnancy. So in the later stages of pregnancy, up until your birth, if you're planning for a vaginal birth, then you haven't planned for an elective cesarean section where it's planned for, then we definitely recommend all women to be doing perineal massage in the late stages of their pregnancy. What we know is there is a good body of evidence that can show that it can reduce the likelihood of having a tear, the severity of having a tear, and the likelihood of requiring to have an episiotomy. It also can reduce and improve the stage of your labour, and it also can improve the outcomes of baby's well-being, even in those first few minutes after birth, because it's essentially having a smoother delivery. It is something that is possible to do, believe it or not, in the late stages of pregnancy. But some women may find the technique a little bit challenging because you have that growing larger bump at this stage. It is something we encourage you to discuss with your birthing partner or your partner, to look to see if they would feel comfortable to help you and assist you with doing this if you find it a bit of a challenge to perform the technique. Essentially, what you can see in this image here is that application of massage and stretch to the perineal tissues. So again, the area between the vagina and the back passage. In this image, you can see that they're applying that pressure with their thumbs, applying pressure on the inside of the vagina in a sweeping motion or in a downward pressure motion. You can see in our little tab there, it talks about top tips to help you to perform this massage. This image says to do about 2 to 3 minutes, but in actually, you might expect that you're doing it for about 5 to 10 minutes, and doing it about 3 to 4 times a week is what we recommend. You may find using a natural lubricant might be really, really helpful to apply that stretch and manipulation to those tissues. And using your thumbs in that sweeping motion or downward pressure can really help. It's something that only physically prepares the tissues for that stretch and that pressure from crowning your baby or birthing your baby vaginally, but it also helps you connect to that sensation that you experienced during labour. It's a good practice for this, to practice on your breathing techniques and to practice on relaxing that pelvic floor during the stages of labour. Can help you with actually that pushing stage in the later stages. What I'm going to do now is save me talking, explaining it a little bit. What I'm going to do is then go on to our next slide, which shows a 1-minute video, which I'd recommend everyone coming back to when the time's right, that just touches on a little bit more about what perineal massage is and how to perform it. But let's not forget, you will have that conversation with your midwife who will explain it more to you at nearer the time.
When to start and how to do perineal massage. Massaging your perineum, the skin between your vagina and your back passage, from 34 weeks pregnancy may reduce the chance of a perineal tear, as it prepares your perineum to stretch more easily during birth. Ideally, you should perform the massage 4 times a week for 5 to 10 minutes each time, but don't do it if you have an active infection, for example, a urine infection, herpes, or thrush. Before beginning perineal massage, empty your bladder and make sure your hands are clean. Use a mirror to become familiar with your perineum. You may also want to take a warm bath or a shower to help relax. Find a comfortable position. This could be sitting with your legs outstretched and back supported, or standing with your foot on a chair. Lubricate your fingers and thumb with a lubricant or pure vegetable oil, then insert your thumb to about 1 inch into the vagina. Massage gently in a U shape from towards your back passage to the other side of the vagina. The pressure should be firm and may be uncomfortable. Try adding some sustained stretches and holding for 10 to 30 seconds.
So hopefully that explains a little bit more about perineal massage and why it's really, really important to try and give it a go, or seek help or discuss with your partner to help you be able to perform and practice that. Something else to consider, which touches on, that leads from the perineal massage and from pelvic floor exercise, again, is coming back to our breathing and our breath works. So we've talked, Zoe's nicely talked to us about our diaphragm muscle, that breathing muscle that we can see on that image there, and the connection it has with our pelvic floor. So we want to make advantage of that diaphragm breathing muscle when we're practicing both our pelvic floor exercises. So it helps us strengthen our pelvic floor squeeze, but it could also help us when we're performing perineal massage and during the later pushing stages of labour, where we're actually relaxing that pelvic floor. So just try and spend that time in the next few weeks and months connecting with your breath and your pelvic floor, and considering that's an important factor moving forwards. Other things to discuss during the or that can be important to discuss with regards to labour and the connection between perineal health and progression of labour is actually choosing the positions that you adopt during labour. So things that we know is that actually adopting positions which are more upright, gravity assisted, can actually reduce the likelihood of that trauma on the perineum as well. And again, the Royal College of Obstetrician and Gynaecologist Perineal Hub has further information and leaflets about that. Same with your midwife. So please discuss the choices, which positions you can get into. I think traditionally everyone thinks it's that lying on the back, but there are so many benefits to being upright and active during your labour, particularly for your pelvic floor and your perineum, but many other reasons, of course, outside of us in our physio world. So making sure you have that conversation with your midwife. So that's probably our section rounded up about perineal health, isn't it, Zoe?
Yeah.
I think what's really important now as we start to close off our session today is just to highlight the benefits that actually seeing a pelvic health physio can provide, and when should I see a pelvic health physio? So we've given you loads of information to prevent problems, to manage mild symptoms. But if you're finding you're trying some of this and you are experiencing symptoms, we don't want you to delay seeing a pelvic floor trained physio who can provide an assessment, which can include an internal examination to assess your pelvic floor muscles. So these are the symptoms that would be important to approach getting a referral for pelvic floor physiotherapy or pelvic health physiotherapy. In some departments, it's termed the women's and men's health physiotherapy team. All of that is the same thing. So it can be confusing, but that they are the team that can support you with bladder control problems, bladder urgency and frequency problems, managing control of wind, wee and poo, or any symptoms that you might experience, such as vaginal heaviness or a vaginal bulge, which could suggest a pelvic organ prolapse, or also painful sex or vaginal pain after birth or during pregnancy. These are all reasons to see a pelvic floor physio. So hopefully that just gives a little bit of signposting to everyone. If anything has raised anything to you today, then please make sure that you are seeking that referral.
If you are experiencing any symptoms, you can refer yourself to the perinatal pelvic health physiotherapy team. Self-referral is possible anytime during your pregnancy and up to 12 months afterwards. For information on how to self-refer, you can visit www.justininorfolk.nhs.uk. Alternatively, signposting information on how to refer will be within leaflets that you have been provided during your maternity care. If you are unsure or want further advice, do not hesitate to speak to your midwife or health professional.
So in summary, Zoe, do you want to kick us off with our checklist summary?
A little wind down time now after you've heard a lot of information. So our take home messages today include: keep active or get active throughout your pregnancy. And if you need some further information on that, then seek that support. So it's really encouraged to keep moving. We really would encourage as well to complete your pelvic floor exercises and aim for that 3 sets a day during pregnancy and then after pregnancy, and download the Squeezy Connect app if you qualify to download that for free as well. So again, thinking about our bladder and bowels, we're trying to avoid and manage constipation, and just remember those bladder top tips to help everything keep flowing nicely and smoothly. And speak to your midwife about reducing perineal tears from normally it's 31, 32 weeks into pregnancy. You will have, births options, appointments. So again, that will be discussed there. And we've given you a head start with the resources from today's session. And if you are following all the advice given today and you think I need that further support, then please do seek that further one-to-one specialist support and assessment as well. So we do encourage that. Lovely. So we do have resources as well, and you may have found us through our Padlet of resources, but we have a wealth of pelvic health information. So all you have to do is scan this QR code or click on the link there.
If any of the information today has brought up any form of concern with regards to your pregnancy and birth, know that there is psychological support for you with regards to pregnancy or birth-related trauma. Each trust has birth trauma and debrief services to support you during and after your pregnancy. Please find the referral information on screen.
And it is a recording, but any feedback we are extremely grateful for. We are trying to improve and adapt the service for the service users and what you want to hear. So please give us any feedback as well. We'd be very grateful. So that's wound us down, and we are at the end of this recording session. Thank you so much for listening, and we hope you find the information useful.
Thank you. Take care, everybody.
Bye.